Hello, everyone. This is Todd Brauch with Senior Insurance Marketing, and we are excited to have Jake with Medical Associates on our call today. Medical Associates, it's a cost plan and is exciting. Basically, it's a plan that you can sell all year round. And without further ado, I'm just going to swing it over to Jake. Jake, welcome, and tell us more about Medical Associates and how that would benefit for the clients, for the agents to sell.
Sure. So again, Jake Godlewski, I'm with Medical Associates. Thanks for having us on the webinar today, Dan. Or Todd, sorry. We've got, we are a cost plan. I don't know how familiar everyone is with cost plans, but we operate just a little bit differently where we, to the members, we very much look like a Plan F, where we're paying 100% of their Medicare approved expenses. And they don't have any cost sharing with that. We have a smaller premium than your typical supplement's going to be, especially for older individuals, and we'll get into that. And there's almost zero underwriting, which is super beneficial if you're trying to get someone in something that looks like a supplement, but they don't, they've got high cholesterol or diabetes or something like that, and they don't want to get them in at a favorable rate. That's something that we can help with. So I'll go ahead and just jump into our presentation so I can start showing you some of this stuff.
Also, just want to let everyone know that's on the call, if you do have any questions, feel free to put it in the Q&A or the chat section, and I'll be monitoring that and read out your question and get it answered for you.
Okay. All right, so here's just a little bit about what we're going to cover. We're going to go over a little bit about our product training process, the administrative process, obviously the important stuff about the plan, how much it costs, what are the benefits, things like that, and then everything you need for compliance. And then a little bit about the broker certification process. We're not going to go into super detail, but just so you know, if you want to get certified, what it takes. This is our marketing team. If you can't see me, I'm Jake Godlewski right here. These are Renee, Mike, Tracy. If I'm out of the office or can't be contacted for some reason, one of these people might contact you. But for the most part, you'll be working with me. And then every once in a while for compliance issues, we might bring Jody in on the process because she's our kind of chief compliance person there. Little history. We've been in business since 1982. So this is going to be the first time you're really hearing about us in Nebraska. And this is our first, it's kind of our debut year here in Nebraska. We were here last year. It was an unsuccessful launch just because we were partnered with CHI and they just didn't have the coverage that we needed. And so we've decided to relaunch this year under Bryan Health, and we'll go into a little bit about that. But we've been in business prior to this 30 years with Nebraska. Out in the Dubuque area, it's crazy. They've got about, I want to say like 65% of the market share out there is the number I think I heard last year. People will literally walk into this little office you see here and sign up for insurance there. So we're very popular out there. We've had a lot of success with our members. We've got over 17,000 beneficiaries as of July last year, and I know that grew during the open enrollment for 2021. The big thing to know is we are a Medicare cost plan. So that means we do have a contract with Medicare, much like your Medicare Advantage plans do. Also, like the Medicare Advantage plans, we have a network that your clients will need to use in order to maximize our benefit. Essentially, in network, we pay 100% of anything that's Medicare approved. That's preventative, that's diagnostic, that's major hospital services, durable medical equipment. If it's hospital approved and prescribed by a doctor, we're going to be, or I'm sorry, an in-network doctor, we're going to be covering that at 100%. We also carry worldwide urgent and emergency services. We classify them as emergent services. Basically, if they're traveling outside of the service area and something pops up, it can be something as simple as a flu, we will cover that at 100%. It's only really for the pre-scheduled appointments that we're going to be real sticklers about them being in network. They do retain their original Medicare. So when a client gets our plan, they're not giving up Medicare, they're not fully coming under a Medicare Advantage, they still retain their Medicare Part A and B. Outside of our network, they can still get coverage just like they would under original Medicare. It's the exact same cost sharing outside of the network that they would experience with original Medicare. So it's not no coverage outside of the network. It's just a little bit of a reduced benefit because, again, they're sharing costs with Medicare as they normally would. This is a big deal. Our 2021 plan rating is also been released, but we are, as of 2021, we have a 5-star rating. And so obviously here for compliance purposes, we want to make sure that you distribute that with all the enrollment, that you notify them of the 5-star rating, but also it means that we qualify for an SEP for any Medicare Advantage plans that you have. So our plan can be enrolled in all year. It can also be disenrolled from all year. You can put them into our plan if they are on a Medicare Advantage plan and they are outside of annual enrollment or open enrollment. We can still take them on and they can still get out because of that 5-star SEP that we open up. And so just keep that in mind if you've got someone who needs to make a sudden change because of health reasons. I know that's a big reason to change out of Medicare Advantage plans. All of a sudden their once-a-year doctor visit becomes a monthly doctor visit and they don't want to continually pay these copays. They can pay a fixed premium with us, manage those costs a little bit more, and we can switch them at any time. Just the first of the next month is as soon as we can always do it. This is our service area for 2021. It has 13 counties. The biggest one is Lancaster. That's where Lincoln is, obviously. And then we have some counties surrounding that. You'll notice we don't have Douglas. We don't have Sarpy counties. That's just because in the CMS requirements state that we cannot operate in a county that has more than 2 Medicare Advantage plans meeting a certain threshold. So if they've got too many people enrolled in 2 separate Medicare Advantage plans, then we can no longer operate there. And so that's why we're not in Douglas, Sarpy counties. And so that gives you an idea of the service area. You can also see that on our website, which I'll put out later if you want to re-reference that. But that's where we're at right now, just to give you an idea. Here's the good stuff. Premium is $147 a month. That's for everybody. We're not age rated. Here's our plan name. If you want to look us up on Medicare.gov, we're Medical Associate Nebraska Senior Plan. There's one plan for the entire state, or for the entire 13 counties we operate in. There's no separation of plans there. That's who we are. We are on the Bryan Health System for Network, which means any Bryan owned clinic, we automatically have that. So if it says Bryan on the name of the clinic or on the facility, they can go there. That's an approved facility. If we also are contracted with the Bryan Health Connect Network, which is the independent providers that associate with Bryan. They don't have Bryan's name on the clinic, but they're in their BHC. We've got probably about 80 to 85% of those doctors. We're not at 100% yet. We're working, but we've got about 80 to 85% of the doctors that are in that Bryan Health Connect network. Essentially, what you can see here with the rest of it is in-network coverage is 100% covered. Out of network coverage is same cost sharing as original Medicare. We do have worldwide emergency coverage as well. So if you've got some people that like to travel, we do cover them. It is not 100% outside of the US. It's a $200 deductible, and then we cover 20% coinsurance when they're outside of the country. Everywhere in the country, as long as it's emergent or an urgent service, we're going to cover that at 100%. Okay, here's our general concept. This is how we like to operate. We pay in full with a network provider. That's for everything: office visits, major healthcare expenses, and preventive and routine services. Virtually no paperwork is another thing we try to do. So when your clients go to a doctor and it's in network, they should never receive a bill or an explanation of benefits. So we don't bother sending them back information that to tell them what we paid necessarily on a certain claim. That's because we cover it at 100% and we don't see the reason to send it out. It seems to increase confusion. And so we really like to do it as little paperwork as possible, that once you have our plan and use in-network doctors, you can really just go to the doctor and forget about your health insurance because we're working in the background. Hospital benefit, again, paid in full, as long as you're using a in-network hospital and it was ordered by an in-network physician. If they want to go outside of the network for some reason, and they don't have a referral, and we'll get into referrals in a minute, it's the original Medicare cost sharing. So the deductible and then the coinsurance that they have to pay with the same out-of-pocket max that they would normally have. Here are just some general Part A hospital benefits that most clients ask about. We do cover semi-private room, intensive care, your anesthesiology, therapy, x-ray, lab services, blood, nursing, general nursing care when it's covered by Medicare, the operating recovery room, surgery, skilled nursing care, medications, and drugs. That's all covered. Part A, again, out of network, same things listed above, but original Medicare cost sharing. Part B, same story, paid in full when ordered by a network physician. Again, you see the list here. I'm not going to go and read through all that, but again, this is the typical stuff that people ask about when they're asking about Part B. We cover it all at 100% as long as it's in network. Out of network, again, it's not no coverage. It's just the same cost sharing as you'd have with original Medicare. There are some additional benefits. We do not offer dental, and we do not offer something like silver sneakers. That's a question I get every once in a while. We do offer 6 routine foot care visits a year. If someone needs that kind of care, we offer 6 a year. We do offer a routine vision exam, and we have that emergency foreign travel benefit, as well as a 24-hour nurse helpline there. The 24-hour helpline has gotten more popular. Everything with COVID, and people don't want to see their doctor as much, so that the 24-hour helpline can be helpful to them. But these are the additional services. One thing not listed on there is for the medical gurus out there that know that Medicare actually excludes the first 3 pints of blood. That's an exclusion on Medicare, so it's technically not covered. We'd still cover that at 100%, which is technically in addition to Medicare. Most members aren't going to think about that, but if they only had original Medicare, that's technically excluded from coverage, but we don't do that. We pay everything from the first pint when it comes to blood. Urgent and emergency care. In the area, whenever you go into a doctor, it's covered just like everything else. We're going to cover that at 100%. Out of the area, if they're traveling outside the service area, it's covered at 100%, as long as it's a urgent care. We do ask them to call and report it. That's because it saves them headaches on the back end. If we see an out-of-network claim initially and nobody's called, there's a high probability, it's not 100%, but there is a high probability that it'll get denied initially and they'll have to call us back. That phone call just stops that from happening. Ambulance services is another big question I get. We do cover any ambulance services that are Medicare covered to the nearest facility. So if the hospital, even if you're in network in a hospital and they take you someplace else, we're still going to cover that at 100% if you were taken there by me. So just know that. Second opinion and referral care. So if they need a referral for whatever reason, mainly because we don't offer the coverage in network, so they need to see a special cancer doctor at the Mayo Clinic, we can get them referral care to that if we don't have in-network care for them. The other thing on second opinions, if they really want a second opinion and don't think that our network doctors are giving them adequate second opinion, we can provide them a one-time referral to go see a second opinion. If they need it. It does require pre-authorization. They do have to, put in the forms and go through the process, but it is something that can be done if they absolutely have to have it. The big thing on referrals is just remember that when we issue a referral, especially for the second opinions, it's for a specific issue or specific condition, and that additional conditions or additional visits may require additional referrals. So make sure that they're under that understanding when they get the referral that they're not covered for that doctor ad nauseum for the rest of the time they're on the plan, that every time a new condition comes up or anytime there's something new, they need to go and seek another referral. Just to be aware of that. These are some things not covered by Medicare, and so they're not covered by us. Typical things: hearing aids, eyewear, take-home medications, dentures, acupuncture, cosmetic procedures, self-administered medications given during an observation stay or an emergency room visit or for a same-day procedure. That type of things is something that can catch someone off guard. So if they issue you Tylenol in the emergency room because you got a fever, you can be charged for that, and that's technically not covered because Medicare doesn't cover it. Orthotics, orthopedic shoes, single shots, syringes and insulins, unless they're used in an insulin pump, and then outpatient prescription drugs. We do not have a Part D plan, and none of this plan covers any type of prescription drug coverage that is not part of Part B. So just be aware of that. Eligibility. So we do have Part A and Part B. That's our only requirements. The other one is, there it is on the bottom. You can see it, end-stage renal disease. I know that was eliminated from the Medicare Advantage plans. It has not been eliminated from our contract with CMS as of yet, that anyone that has end-stage renal disease, they can still not get a Medicare cost plan. We can, if required, we can cover disabled individuals if need be. So it's just required that they have Part A and Part B, not that they be 65. General information. There's no health questions except for end-stage renal disease. Our app literally just has that one question. There's no pre-existing clauses or exclusion. There's no lifetime benefit maximums. Again, that's just consistent with our no underwriting policy. It's not age rated. The other two things to know is we can't retroactively enroll anyone, and we can't enroll anyone more than 90 days out. That's not typically an issue. That seems to be in line with the rest of Medicare, but that's just to be aware that we can't ever backdate. And that includes if you sign somebody up, hey, can we get them in for this month? It's the last, it's the first. They have to be in before the first of the month. It will go to the first of the next month, if that's the case. So just be aware of that for timeline when considering to enroll someone. I can do last day enrollment, so just so you know, if you've got someone coming in on the 30th or 31st that needs a next month effective date, we can get that done. You just need to get on the horn with us. Make sure we know it's coming. We'll be aware of it, and we'll get it processed for you right away. So we can't do last minute, but we can't do anything retroactive. Our two payment options right now are automatic bank withdrawal and coupon book. So we do EFT, but that's it. We don't offer any type of online payment if they're used to that, and we do not deduct from Social Security payments if that's what they want to do. We do need to at least do an EFT, or they can send us a check every month. Enrollment process. So after you enroll them and send us the application, these are the documents that any member is going to receive. They're going to get an acknowledgement letter from us, typically within a week or two. That's pretty quick. And then we're going to send them a separate letter that actually verifies that they've been enrolled and it's been approved by CMS. The third thing they'll get is an ID card. Be aware from that, because that gets thrown out a lot. And they do want that ID card, so make sure they're aware that that's coming. We send them a handbook with an evidence of coverage that should have, we should leave that with them when they're there, but if not, we're going to send them one as well. Acceptance letter with CMS approval, that will eventually get to them. And then if they need a coupon booklet. We do send them annual notice of changes if there's change. And then the evidence of coverage by the October 15th. A lot of that you're going to notice is in line with an MAPD because we have a lot of the same requirements as an MAPD in that sense. We do an audit for every member. So we're going to call them 2 to 3 months after the enrollment. We're going to make sure the beneficiary understands plan benefits and the network, and then any issues they have will be documented. That's just we have compliance things that we have to satisfy for CMS as well. The Medicare commission schedule, there's been no change to that from 2020. I'll defer to Todd on that one. That's a special structure that's been set up for you guys through Senior Insurance Marketing, and they've got all that information there. Everything complies with CMS guidance. CMS provides a report on initial or renewal beneficiaries every year. This is all kind of typical stuff. Just remember, everything applies to all independent brokers as well. So that's the big thing. Release of information. If you want your members, if you want to be able to handle your members' customer service issues, they need to fill out that release of information with your information on it. The other big thing to cover in here is to make sure the members are aware that when they sign that release of information, anybody at your agency can call in on them with that release of information, that it's not only specific to you, it's to your agency. So just be aware of that. It's only valid for 2 years. So if they stay with us for a long period of time, which we hope they do, and we're expecting them to, then that needs to get reauthorized every couple of years so that you can continue to handle their customer service claims. Again, I meant to skip over or to include this slide on there, but again, it's just make sure they're signing that authorization form if you want to help. If you don't get them to sign that form, you can't help them with their insurance. There is a possibility that if they decide they want your help last minute, you can have them be on the phone with you, call us, and we can do a verbal authorization with that. This is good to remember. We take enrollments every month, so there's never time they can't get on. I mentioned the SEP earlier in the call. So even if they're on a Medicare Advantage plan, we can enroll them in our plan. They are not locked into our plan. They can get out at any time. So if they don't like it, they don't have to wait till AP to get out. We can get them out right away. We do qualify for the look back period. So if they're on a supplement plan, we qualify for the same period that they would get if they were to enroll for the first time on a Medicare Advantage plan. Remember, it's the exact same. So if they've already used it to get into a Medicare Advantage plan at once in their life, we don't qualify for a separate one or a new one. But if they have never been in a Medicare Advantage plan and they'd like to try us out instead to save them some money but still get that 100% coverage, that is something that we're allowed to do based on CMS. So just remember that. As far as the sales process is concerned, these are the items that we send you in our enrollment package, and if you get them from us. It's an enrollment application, EFT fund, a scope of sales appointment, a release of information, pre-enrollment checklist, summary benefits, and the provider directory. The big thing here is the scope of sales appointment. We do need that turned in with your with any type of document, or with the sales documents that you send in. We do need to see. It doesn't need to be just on file. It has to be. We have to actually see it and keep it on file for. Again, some reminders when going through the sales process. The big one I would say here to focus on is to collect the first month premium. When they sign an EFT, we still need the first month's paid by check, and then every month following will be EFT. So we can't take the first month's out of an EFT. That is something we're working on getting changed to be in line with most of the other carriers, because we realize that most carriers are now doing that. The first month can also be some sort of electronic funds transfer. It's in the works. I don't have an exact date on when that's going to be around, but as of right now, we still need to collect that paper check. Again, scope of appointment, make sure that's getting turned in with their application. And then basic standard CMS stuff, make sure you're using current plan materials. The enrollment process reminders, paper application needs to be entered into and submitted into our system within 24 hours. So we do require the paper apps, but there is an electronic form for brokers to fill out within 24 hours of the enrollment. And so just be aware of that you'll have to get on the broker portal and input their information, and then you can mail in the application if you want, or you can send it in by email or fax to us there. Yeah, we do, again, just with that second bullet point, you're still going to need to actually mail the check into us. So just be aware of that we're actually going to have to receive the check in the mail. They do monitor the use of portal and timeliness, and non-compliance notice and disciplinary action can happen from that because we are scrutinized by CMS as well. This is what is required for to be certified with us. There is a compliance attestation and all the CMS requirements with that. And then there is basically a product knowledge piece. Anything that has to do with compliance can be waived as long as you have your AHIP certificate. If you've got an AHIP, you send that into us, and really you only have to worry about the product piece. I had to sit through the compliance and product training just so I was aware of it. The entire thing with compliance took about 2 hours to complete. If it's just the product knowledge, it's much, much shorter. I know that Todd has been sending several people through, and he can attest to a little bit more about what the average time length is to complete that, but it's not very long for our product knowledge piece of it to get certified. And it's all online. You can print or save the slides for reference during the test if you need to, and we don't have a limit on how many times you can fail the test as well. And that's a question that gets asked a lot. So you have unlimited time to take the test. Production reminder, we do have a minimum production level for any agent. It's 2 plans minimum for 2020 if you want to continue to be certified with us. Here's our website. these are the things that you can find on our website. You can get our provider directory. We have an electronic version of it as well as a PDF that you can download. The online one is the most up to date. You can get our summary benefits, evidence of coverage. If there's appeal or grievance, you can handle that there. Plan guidelines and premiums. And then there is our member service department number if you should ever need it. Here's our provider directory. A lot of people want to look at that, sometimes even before they sign up on the plan. You will go to this website right here, mahealthplans.com. And then there is a right here where it says insurance. That's where you'll want to click. Click there, and then I want to search for a provider. And then there'll be a separate page that allows you to click on Medicare, and then you just click the Nebraska plan, and it'll take you here. And you can see by the form the different ways you can search providers or clinics. The best way to search clinics is actually to download the directory and just Control F and see if the clinic is in there if you're looking just for a specific clinic. I will say that if we have a clinic in our directory, we cover all the providers at the clinic. So just remember that. If you're not seeing a specific doctor, we are still working on credentialing some doctors, but if it's got the clinic in there, we cover everybody. Here's some CMS notice oversight that we do and that's done to us. We're subject to all the same CMS penalties for noncompliance as everybody else. We can send you notice of noncompliance, corrective action, suspension of marketing and enrollment. There can be monetary penalties, and we can terminate your contract if need be. So just be aware of that. We can also have all those things done to us. So just be aware of that before noncompliance. The things that we've got coming up. So these are things like, hey, are you guys ever going to do this? We are working on it. So one site for brokers to log on to in 2021. Right now, it's a different website for training as opposed to our broker portal. We're working on getting that in one. And then email newsletters and updates for you so you can be aware without having necessarily to log on the website. And that is pretty much it. I'll turn it back over to Dan and then see if there's any questions there.
Hey, thanks, Jake. I really appreciate it. And we do have some questions. So for the first initial premium payment, you said that by check. Can you also do credit card?
You cannot do credit card. No, it's check, paper check.
Just check only. Okay, got it. Okay. So I'm seeing some other questions here. And if you do have any questions, either put it in the Q&A or the chat. That's no problem. And we can read it off here. So have a few questions here. Can the client disenroll at any time?
Yes, anytime.
Okay.
Yep.
Anytime. Okay. Just also, just need more clarification on the 5-star program.
Okay. So we're 5-star rated. So obviously, CMS provides a star rating. Most of your MA plans are going to be 4 stars. There's actually 5-star plans in the entire country. We are one of them. So that's a bullet point for if you're trying to sell confidence on the plan to a member, because we're one of the 5 that get it. The other thing is, on the 5-star, when you have 5 stars, there is a special enrollment period through CMS that allows a member to disenroll from their current Medicare Advantage plan and enroll into that 5-star plan. And it's good all year. So as long as you're enrolling a member into a 5-star plan, you can disenroll them from their current Medicare Advantage plan. And so we qualify that, even though we're not technically a Medicare Advantage, we do qualify for that still. So you can, so if you've got someone on Humana and they hate it and they just want to get out, you can enroll them on our plan. We've also seen it where individuals, again, run into a medical condition where now they're going to start seeing their doctor regularly and there might be some considerable expenses. You can still enroll them on our plan. And we can start again first of the month effective the next month on that. That's the 5-star and what that means to your client and to your business in a nutshell.
So basically, kind of with that example, to sum it up, they can get off of a Medicare Advantage anytime and go to a cost plan just because of the 5-star
rating. Right.
Rating.
So if we didn't have that rating, they couldn't do it. But because we have that rating, they can.
Okay. Would they have a guaranteed issue going back to a Medicare supplement or an MAPD
yes,
plan?
They get the same guaranteed issue rights as they do for that 1-year free look. Again, if they've already used it, we don't qualify just like any other MAP. So make sure they haven't used it. But if they've got that open, yeah, we qualify for that 12-month look back. That also applies if we were to ever leave the area. They get a 12-month, or they get that same guaranteed issue right that they would normally get if a plan were to go away.
Okay, got it. Next question is, are there any co-op dollars for marketing purposes?
Yeah, so that is a case-by-case basis. But I was actually talking to Todd about this before. That is something I want you to send up, and that's something that I fight for on your behalf. And it's something that management has been amenable to for the most part. I haven't heard him say no. What it's looked like in the past is we've had some mailers sent out, and we have our own printing press there in Dubuque, and so we can print some stuff out relatively cheaply, and then sometimes we're willing to pay for part of the shipping costs. The big thing is if you want to send stuff out either electronically or via mail, and you want some help with those costs, as long as I'm the only guy on there with your name, not me personally, but Medical Associates, you don't need to have my stuff on there. As long as I'm the only guy on there, that's definitely something I'm willing to push up and fight for on your behalf. So just send it to me, and I'll try to get it approved. But it's definite high probability that we've got something for you.
Okay, perfect. And definitely just contact us here at Senior Insurance Marketing, and we can work with Jake on that to get that going for you as well too. So next question is, how many providers would you think are available on this plan? And also then that's part A, and then part B is, how likely is it to get one added if they're not on the plan?
So as far as exact numbers, I don't know exactly how many providers are on the plan. It's a good chunk. If you go to that website, you can see them all. You can download our entire directory. That gives you an idea. That is a growing number still. It's a pretty good chunk here, especially if you're looking at Lancaster. It's a really good chunk. The other big area where we're very strong is in Beatrice, down in Cage County, to be aware of. How hard is it to get one added? The big question is for providers is, do they admit to a network hospital? So if you've got a provider and all he admits to is CHI, that we probably won't be able to put in our network, because that's going to create issues if he ever needs to refer them for more significant care. If they're reporting up to Bryan, if they're admitting to Bryan or one of our critical access hospitals that we have in one of the smaller towns that go up to Bryan, then that's a much higher possibility. Especially if you're in a smaller town where this might be the only provider. That's something that we're shooting for. There's a little bit of ambiguity where there's a lot of providers, and a lot of providers, where we have a lot of providers already in the Bryan Health Connect network. It's just a conversation we need to have with Bryan, and to make sure they don't have issues. We don't have a problem admitting them, but I know I tried to get a non-network Bryan provider admitted. It turned out they didn't admit to a Bryan hospital, so it was a wash anyway, but it was a conversation that we needed to have with Bryan that we never got to. So again, if they're already with either Bryan Health Connect or they're admitted to a Bryan hospital, it's pretty easy. But it's not something definite I can give you an answer on. But again, it's something I always want more providers. So again, send that up and we'll work with them.
Okay. Yeah. So if you do have a provider, let us know, and then we can work with Jake to get that provider added on that list then. So next question is, are we able to create our own mail pieces to be approved? And I'm assuming, I'm just going to add this other part to it to be qualified for the co-op dollars as well.
Yeah. Send us the mail piece and I'll send it to my marketing team. And they'll scan it for anything that they're not willing to be associated with company-wise, which is probably nothing, and then CMS. We'll submit it for CMS for approval.
Okay.
But if you've got your piece, that makes it even easier, because we don't have to have our marketing guys design it. So.
Okay, cool. Is there like a list of what's required, just so it gives the agent some guidelines when they are developing the piece of,
I'm
What
looking
should be
for-
required, what,
Yeah,
the
give me one
compliance
second.
requirements are?
I'd have to get back to you on what's
Okay.
required. I don't know the exact, there is a list of requirements.
Okay.
I could get it to, I could get it to CMS, or I could get it to, they could tell me what CMS requires of them.
Okay. Okay.
There's a lot of it has to do with like print size and
Font size and everything.
certain language. Yeah, certain language would be the big thing probably for you guys. We can adjust any print size you got,
Okay.
but that's a big piece of it.
Okay. Perfect. Anyone else have any questions? Very good questions here. Also, I just wanted to kind of pitch here too. Another way for agents to be kind of to help them out with scheduling appointments and everything like that is virtual calendars. So if you haven't looked into a virtual calendar, let me know and I can kind of guide you through that. It's a very, very easy process and another way for having someone else, having technology work for you and to help you schedule appointments with your clients and where the clients can just schedule appointment with you, whether it be a Zoom or in person as well too. So give me a call, be happy to help you out and walk you through a calendar program. There's a plethora of out there. Also go to our website, simkt.com. We just launched a new website about a month ago. We are adding more items to the website, and also we're adding more training videos, more how to sell videos as well. So be on the lookout for that as we add it. And also this webinar will be on our website as well too, so you can go back to it just in case you missed something. And if it's 10 o'clock at night on a Saturday night and you want to view it, you can definitely view it in that. So Jake, I don't see any more questions, but I appreciate everyone attending. And again, give us a call here at Senior Insurance Marketing or send us an email. Our phone number is 877-800-3080, and our website is simkt.com, and you can email us through the website, and we can get you contracted with medical associates and get you started so you can sell this product, which you can sell any time of the year, as long as they don't have in-stage renal. You can offer this to the client in that, and also make sure that the doctors and providers are in the network as well too. So, any other closing thoughts or anything, Jake? Or
nope. If you guys have any issues, like I said, pass it up to SIM. They'll get it to me. We're super interested in partnering with you guys in any way we can. So whether that's providers or marketing or whatever you need, just let us know.
Great, awesome. Great. Well, hey, thanks everyone. Appreciate it. And give us a call. We're here to help you grow your business and also to help work with your clients too on a case that you're working with that we can find the product and the company for you as well too. So take care, everyone, and have a great day.